afternoon. Welcome to the 2009 annual meeting of the American Public Health Association. My fellow Alaskans and I bring you greetings from our beautiful state as we celebrate our 50th anniversary of statehood. This is an accurate depiction. This is an accurate depiction of the size and extent of Alaska's land mass. As you can see, we're not in that little box that you always find at the bottom of the weather map. I join our immediate past president, Dr. Linda DeGutis, our president-elect, Dr. Carmen Navarez, and our executive director, Dr. Georges Benjamin, in expressing gratitude for the wonderful hospitality extended to us in all the places we visited recently. I'm also grateful for the kind welcome I experienced in related travel to Illinois, England, Scotland, China, Turkey, and Inner Mongolia. I'm indebted to Dr. Benjamin and the APHA staff for their kind assistance, and to all of my colleagues at the University of Alaska Anchorage and the College of Social Welfare for their patience and support, even when it seemed that I was but a figment of their imaginations. I'd like to thank my wonderful family and to acknowledge those who are here. My brother-in-law, Dr. Gregory Allen, my dear friend, Dr. Judy Storfield, Dr. George Charles, who represents my Alaska Native loved ones, and my beloved sister, Dr. Cheryl Easley Allen, a past president of this association, who is a never-ending source of inspiration and wise counsel. Finally, thank you. Finally, my thanks to all of you for the opportunity to represent you in a year like none other in my life. I want you to remember one sentence, this one sentence. Everyone has the human right to the highest attainable standard of health. I would like to share with you what this sentence brings to my mind. The human right to health, of course, does not mean the right to be healthy, but rather the right to the conditions that give us the choice to be healthy. These include universal access to health care, a comprehensive public health system, and all the conditions that make for health. This summer, as I met with international colleagues in the United Kingdom and at the World Congress of Public Health meeting in Turkey, I was interested to see how often their discussions of health and health care were framed in the language of human rights. I contrasted how often such conversations here are couched in the languages of finance and politics. Not to say that money and politics are not important, but they are means and not ends when we are considering the lives and welfare of real people. Last night, thank you. Last night, our House of Representatives took a historic step toward providing access to health care for the American people, closer than we've ever come before. I know, thank you. I know that this victory was due in large part to the efforts of many people in this room. Thank you. But I'm impatient that after decades of struggle, we move ahead quickly to fully realize this one piece of the right to health. So like other nations, we can focus our efforts more intensely on the challenges of health promotion, the elimination of health disparities, and the social determinants of health. In the Universal Declaration of Human Rights, the people of the United Nations reaffirmed their faith in fundamental human rights and equality. The right to health, as well as other human rights, is founded in respect for the inherent dignity and worth of the human person. It is incompatible with respect for human dignity that citizens of the wealthiest country on earth should be obliged to line up in an open field to obtain health care through the kindness of health professionals. It is incompatible with the recognition of human worth that Americans experience exacerbations of illnesses and die due to lack of health insurance. Human rights are universal legal guarantees protecting individuals and groups against actions which interfere with fundamental freedoms and human dignity. Rights always involve a claim of one person or group against another entity. Human rights, therefore, are claims that we as citizens can justly make against our government. Indeed, our seminal national document, the Declaration of Independence, maintains that it is to secure rights that governments are instituted among men. Human rights, including the right to health, are established in both national and international law. The right to health is elaborated in these and other international covenants and declarations. The International Bill of Rights comprises the most fundamental statements, including the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, and the International Covenant on the International Covenant on Economic, Social, and Cultural Rights, the last of which sets forth the right to health. The documents that follow elaborate the basic provisions of the Bill of Rights, including the right to health, often as they apply to specific populations. Every nation-state, including our own, has ratified at least one of these documents in which that right is enjoined. All of us should embrace and read the international documents that assert our right to health and that undergird our work in public health. I hope for the day when instruction in human rights is routinely found in the curricula of public health and other health professional schools and programs, along with professional ethics.